Season 2, Episode 3. Things are really starting to heat up this July 4th. Let's get started. Huge thanks to Rocket Money for sponsoring this video. Be-whoop.
Talking to me, you can't. Title 2710.
Hard to assess pupils. Hard to assess anything.
Yeah. Wait till after he's sedated.
Can have a Lansipine?
No, that'll take 15 minutes to kick in. 5 of Deperidol, put them down at 5.
No, you can't give it without knowing his QT.
2 beats of a rhythm strip before we took off the lead.
So you got to be careful with some of these medications. They can have implications on the heart rhythm. We talked about this earlier on an earlier episode when we were discussing torsades as a potential rhythm that can happen as a result of a prolonged QT interval. But that's what they're trying to check on this EKG, even though it's very short, obviously.
Get out.
That looks good. Go with the Deperidol.
The medications that they're discussing are antipsychotic medications to help sedate him.
Get off me, man. 2901, get out.
That would be an IM dose because it's intramuscular and it's going to be very quickly absorbed.
2710. Title 18, section 1938.
I wonder why he's acting so aggressively. Could be substance abuse, but it could also be a whole host of other issues. So need a lot of blood work, a lot of imaging here really quickly.
I'm sorry, Miss Graham. I just saw the ASO note in your chart. This is Lindsay. We'll bring you back as soon as possible. Stay with her. All right. Who here needs help?
Let's listen to see what you...
You? You need help?
Oh, no, ma'am. I've been on these since 1987. This one here, he got dizzy, fell down.
Forgot my blood pressure medication.
A lot of patients end up going to the ER for forgotten medications because they don't have good contact with a primary care doctor. I have patients that message me all the time when they're on vacation, they forgot their medicine, they lost their medicine. And if you have a good relationship with the doctor that you see regularly, that should be an easy correction for a temporary solution, not clog up an ER.
Yo, can I get some help over here?
Yeah. What's going on, man?
The crazy kid in there screaming.
All right, have a seat.
Yeah, that's him. Still going nuts. Probably meth.
What's your name, sir?
Tony Cinciolo, campus security. Yeah, I was at work when this happened, so I'm gonna need everything documented.
Okay.
All right, heart rate's 89, pulse ox 97.
So he's not tachycardic, he's oxygenating well, reassuring vitals.
Scalp black's tiny, 5 millimeters, should hold together with Dermabond.
So they're just gonna put some skin glue basically. They're not gonna even need to put staples in, which is pretty common on the scalp.
Okay, so you're gonna want to clamp where the shaft meets the burb. Yeah. Stabilize the skin.
What is that? What's impaled in his back?
Like a taser electrode.
Oh.
Harder. Yeah, harder.
Do we suture those?
Nope, just a Band-Aid.
Mel, we need orders.
Right.
I got a rainbow.
CBC, CMP, UA, blood alcohol intox.
All the above.
Those are all blood tests that we would order preliminarily to gauge what's going on. They'll give you an insight as to potential infection, electrolyte abnormalities, substance use, etc.
If this young man's stable, can he go to Central 10 pronto, double trauma at the back door?
Okay, you heard the boss. Let's get going. The day is starting to heat up.
Marquis, 32-year-old restrained driver, auto versus motorcycle, altered with normal BP setting 99 and 2 liters.
So in situations like this, because of the mechanism of injury, you're going to pan scan this patient. You're going to get a CT scan, likely chest as well. And then if there's any other signs of trauma when they're doing their full analysis. Because again, they're doing their basics, A, B, C, D, E's.
1, 2, 3.
Incoming.
Okay, Joy, you stay with me. Samira, you stay with Dr. Alashimi.
Open skull fracture, tubed in for agonal respirations. BP 60 palp initially started a liter of NS, but lost his pulse en route.
So this is a person who's very, very sick, bleeding into their skull, losing a lot of blood because the blood pressure is really low. But now this person is pulseless, so clinically they're dead and they're trying to resuscitate them using chest compressions, chest compressions, chest compressions.
Oh boy, this doesn't look good.
And 1 liter of normal saline is some fluids, but it's not enough fluids when you're trying to bring back volume to a patient who has lost a tremendous amount of blood. Fluids like normal saline, they can help fill the intravascular space inside the blood vessels to boost pressure, which technically does improve the patient's state, but really what the patient is losing is red blood cells because of the blood loss. And when you have loss of red blood cells, you have the decreased ability to deliver oxygen to tissues. So it's not enough to just put IV fluids in, you also need to do blood transfusions.
1, 2, 3.
Joey, check his pupils. Somebody hand me a pair of scissors.
Non-reactive.
AKA blown pupils fixed and dilated.
Yeah, blown pupils fixed and dilated means that there's significant neurologic damage, bleeding inside the brain.
Oh,
Crushed skull with tons of gray matter extravasation. At least it was quick.
No helmet?
Nope, because he took the PennDOT motorcycle safety course.
Isn't that what you took, Robbie?
Full compressions, yes, but I still wear a helmet.
Ah, caught in the lie on camera. Little did Robbie know that HBO Max was following him around with a drone.
Is he a donor?
Also, nope.
That is too bad. Hey, Cicely, I think we are done here.
What's next door?
The guy who hit him.
Yeah, with the amount of injury that's present, the chance of bringing him back is almost nothing. And also, potentially trying to even bring him back is not giving any kind of valuable quality of life. So it's very reasonable to call time of death here.
Pulse ox 99, BP 108/72.
EFAS negative. Hell of a lot better than the guy next door.
How's the airway?
Good volume, good sats, gag reflex.
Present.
Those are part of the Glasgow Coma Scale that we use to create a rating in order to decide management of this patient.
Intubate?
Maybe, maybe not.
Mr. Yee. Joy, start a rub on his chest like this, really hard, please. Mr. Yee.
Spontaneous eye movement, response to pain, GCS is 10, borderline for intubation.
The number that I learned is when you're GCS 8, you intubate. There has been some changes to this, but a lot of it is dependent on the clinical situation.
No muscle tone, flaccid paralysis in the left arm.
A lot of times, if they're fearful for a patient to not be able to protect their airway, meaning that they have no gag reflex, as an example, that if they were to vomit or a foreign body goes into the airway, the tongue falls back, they're worried about the airway being obstructed so that they preemptively sedate the patient and put in an ET tube.
Same on the right.
And both legs.
Add towels to both sides of the collar for more stability. Let's not make this worse. Pan scan with 3D reconstruction of the spine.
Which is what we were talking about earlier, making sure that the patient is fully scanned.
He's quadriplegic? If so, it's a low cervical injury.
Why is that, Joy? C3, 4, and 5 helps you breathe to stay alive.
I'm sure you have some questions. I know it's a lot to take in.
It's a tumor. It's a brain tumor.
Is it a glioblastoma?
About 4 centimeters in the frontal lobe.
Is it cancer?
We can't say for sure right now. It could be many things. Infection, inflammation, a benign cyst.
Usually there are radiographic findings that could point you in one direction or another.
Is it what made me fall?
Yeah, possibly. We'd like to keep you here and treat with dexamethasone, which is a steroid to take down the swelling. And then we'll need a brain biopsy.
And not all brain tumors are in a position where it's possible to get a biopsy. Sometimes it's in an area where doing a biopsy could be more harm. So it needs to be really evaluated by an experienced neurosurgeon.
You're gonna cut open my head.
It's just a small hole. We'll do a CT-guided stereotactical biopsy with a blunt, thin needle, which sounds crazy, but it's actually pretty amazing. I mean, most patients go home the next day.
I'm also surprised that this is happening in the ER. Generally, a patient like this, we would recommend that they stay. We admit them to the service, meaning to the internal medicine floors, maybe the neurologic floor if they have one, and the internal medicine resident would take over admitting the patient, and ER would sort of sign off given the fact that they've stabilized the patient and created a dispo, which means a disposition, meaning that the patient is scheduled to be admitted in-house.
I think this is a pretty good plan.
Okay. I would also offer to call one of his loved ones to see, because he's clearly confused, and perhaps it would be of benefit to have a loved one near him during a moment of stress like he's experiencing.
BP 95/67.
95/67 is technically a normal blood pressure as long as he's asymptomatic.
Seems a little on the low side.
It is.
Have you ever had low blood pressure in the past?
No, sir. My blood pressure is always high.
Unless he's taking too much of his medication.
Hanson's all run high, except for money. Well, he ran low, but he's dead.
It's not helpful. You want to help? Quit playing family pharmacist.
Pulling meds is how we've always done it. You put everything in a big pile in the middle of the table.
Well, look where that got us now.
No, I'm
Slate.
going to jump in here and echo that sharing meds which haven't been prescribed to you is actually a real big no-no.
It's a real big no-no because there are medication interactions and certain medications, depending on a patient's other medical conditions, other comorbidities, we call them, could get them in a lot of trouble. Because when we prescribe a medication, even an antihypertensive, we do it thinking about the patient as an individual. What other meds are they on? What risks do they face? What other medical problems do they have?
Well, how are we doing on remembering what your brother might have taken?
We could go back to the house.
Great idea. Okay. Whatever little round pill you took, sir, has caused your heart rate and blood pressure to drop so low you're at risk of fainting, falling, or having a serious injury.
So that is hypotension, low blood pressure, because it is symptomatic now.
We need to take him back to the ER.
Yeah, his pulse is quite low at 56. So I wouldn't be surprised if he took either a combination pill, meaning like a beta blocker with an ACE inhibitor or a hydrochlorothiazide with an ACE inhibitor. So there's a world where there's two medications involved, or perhaps one at a very high dose.
So we can get a liter of fluids, we can check his blood tests, and monitor his heart rate and blood pressure until he recovers.
I also would like to see an EKG.
Hold still, sir. No talking while we do the EKG.
Which would show if there is heart block present, because that might encourage you to act more aggressively than just giving fluids.
Pulse ox holding steady at 99. Good tidal volume.
How you doing there, Mr. Yee?
Scanner can take him now.
I'll check the results from upstairs.
Why is he so altered?
Could be concussion, maybe a small intracranial hemorrhage.
All will be revealed by the donut of truth.
The donut of truth is the CT scan.
Did I hear someone say he's paralyzed?
There are signs of weakness in both arms and legs, but before we can make any prognosis, we'll need a full body scan.
Not just a full body scan, but also for some time to pass, because unless you see how the person starts improving over time, it's hard to give a long-term accurate prognosis, especially when it comes to the neurologic system.
Head CT will show us any brain injury, and neck CT will show us any spinal cord injury. Chest, abdomen, pelvis will rule out any internal bleeding.
Oh my God.
The scan should only take about 15 minutes. In the meantime, perhaps you'd let us look you over as well?
I'm fine. The medics checked me. I just want to stay with my husband.
Well, you can't go into the CT with him, but you can wait just outside if you like. Princess, this is Nancy. Mrs. Yee's going to go with her husband to CT. Will you show her where to go?
Sure, come on in.
Thank you.
Back to the show in just a second, but first I want to talk to you about Rocket Money, an all-in-one personal finance app that helps you cancel subscriptions, lower bills, and manage your money better. It's the start of a new year, which for me always means getting the finances in check. The end of the year brought on a lot of expenses for the business, so I'm looking to tighten up the wallet just a little bit. That's where Rocket Money comes in handy. Once you connect your bank account, Rocket Money identifies all your subscriptions in a single list. From there, you can select the ones you don't want anymore, and Rocket Money can actually be able to help you cancel those with just a few taps. I did this myself. You see, I had forgotten that I was subscribed to all these paid app services on my phone, which meant I was literally paying money every single month for services I wasn't even using. Absolutely brutal. Sometimes I get a little eager and sign up for a free trial somewhere, and that turns into a monthly bill that's easy to forget. Rocket Money helps me solve that problem. And in general, connecting all my accounts to Rocket Money helps give me a bird's eye view of my finances, meaning fewer things slip through the cracks. Rocket Money is free to download, but you can get a free premium trial when you sign up using my link. Go to rocketmoney.com/Dr. Mike or scan this QR code. I'll also include the link in my description. All right, let's get back to the pit.
So you bandaged the burn yourself? Oh,
No.
Ma'am, you're making it difficult for me to see under this dressing. Is that a tablecloth?
Part of a window curtain. Cleaner than tablecloth. I'll wait for the doctor, thank you.
But may I ask how this happened?
For weeks on end, the kids with their hoochie firecrackers going all day and night.
Oh, is this a firecracker burn?
No, sweetie, this is from the full samovar I drop on the floor when this...
I'm assuming she's Russian?
The firecrackers started going on again.
I'm sorry, what's a samovar?
It is a big metal urn for coffee or tea. They can get super duper hot, and I was never allowed to touch ours.
This is so embarrassing to share on camera. When I was a child, I'm gonna blame my father for this. My father would always recommend that my sister and I, whenever we had an upper respiratory infection, we would lean over a steaming pot of water with a towel and get the humidity of the steam in order to open up our airways. In theory, good idea. However, not a good idea to let a 5-year-old carry said steaming pot because I spilled it all over my lower body, including some sensitive part. But it burned bad. I cried a lot. I'm still crying internally.
Emotional damage.
Hello, Mrs. Kovalenko. My name is Dr. Michael Rabinovich. Everybody calls me Dr. Robbie.
Rabinovich, Jewish?
You guessed it. And I see that you are here today for a burn.
Please close the drape. What's with this show not closing the drape?
Ooh, what did you put on this?
Ooh, that's a pretty extensive burn there. That looks full thickness already. 2nd, 3rd degree.
On your burn. Is this honey?
Yes, honey. Where do you go on holidays?
My grandparents, I grew up going to Rodef Shalom. You?
Tree of Life?
They're rebuilding.
Yes, something new. Remember, rebuild, renew. That's a slogan.
I'm sorry, did you say honey?
You think honey's funny? Works like a charm.
Honey does have antibacterial properties, and actually, when I worked at the wound care center, sometimes when we had multi-drug resistant organisms, honey would be the sole product that would work for our patients who have terribly infected wounds.
If the honey is medical grade and the burns are not too bad, honey actually does have some antibacterial and anti-inflammatory properties.
I love that we just echo each other back and forth. There is actually a medical grade honey that you can prescribe.
These burns are very deep in some places. They're going to need debridement.
Debridement is what we talked about in the past about needing either, well, it used to be maggot driven, but now that we have chemical debridements or even physical debridements, and sometimes physical debridements can be painful. So we do give patients pain control in those instances.
You mentioned that you dropped the samovar when you heard firecrackers.
Yeah. I was on my way inside, October 27, 2018, to the synagogue when the shooting started. There's nothing I could do.
This is a really powerful conversation, but I still am struggling here. They're working on an upper thigh of a patient, so she's pretty exposed. It's a heavy conversation. It's an exam room, so they're not like in a hallway. Why is the drape open?
Anyone here treating Kylie Connors?
Hey, she's my daughter. She's 9. I'm Benny Connors.
Mr. Connors, I'm Dr. Santos. I'm treating Kylie.
She okay? Can I see her? My girlfriend Gina says she got a cut on her chin.
Yeah, I can take you to her. She has a small laceration on her chin, but it was easily repaired with medical superglue, so no stitches necessary.
Okay.
She chipped her tooth, but it's a baby tooth, so it won't need dental work.
All right, well, that's a relief.
Has Kylie had any previous injuries?
Yeah, she broke her wrist last year. She was skateboarding.
Dana, if you could get Dylan to come to North 1 and Ahmad.
You bet. Okay, I got it now. 1, 2, 3.
Daddy, you okay?
Oh, baby, what's going on, huh?
My chin's broken, my chin got cut.
Oh, no. What happened?
She was running up the stairs.
Jana was chasing me.
And we were playing.
As I was saying, Mr. Connors, the laceration's pretty minor.
On the stairs?
It was an accident.
Perhaps we can step
Accident that wouldn't have happened if you weren't running up the stairs. Do
We
you
weren't
understand what I'm
running
saying?
up the
This is the last
stairs.
thing that I need right now is her mother finding out that she got hurt when she's with you.
It was an accident. And before you get all high and mighty, I've got questions of my own.
So far, this is a pretty typical family argument. Like, this happens all the time. They already had baseline suspicions, so it's making them act a certain way, but still, this is well within reasonable communication of certain families.
Why do I gotta talk to a social worker?
Anytime a child's injured, we have some standard questions that we ask parents and caregivers.
Good, that's fine. Great. Ask me here.
Well, we noticed some bruising on Kylie's body, some old, some new on her back and legs. Any idea how she got those?
Yeah, soccer. She plays for a club team. They're, little girls, but they play like they're in the Hunger Games.
Well, I understand that you and Kylie do a fair amount of roughhousing.
What? I'm sorry, are you kidding me? Where are you going with this? Are you saying that I hurt my daughter?
Mr. Connors, no.
Oh, no. Gina!
Mr. Connors?
Just, Gina!
Sir, take a breath.
Gina, what did you say to them?
Nothing. I said that you're a great dad.
Okay, what else?
That you guys like to wrestle.
Jesus
What?
Christ.
They wanted to know where all her bruises are.
Who the f are you to talk about me and my daughter?
Separation. Separation. Who's the family member? Who's the father? Who's not? Should leave.
Back the
Stop! Kylie's platelets are only 9,000.
Ooh. Thrombocytopenia?
It's not what we thought.
It's not what we thought. You shouldn't think anything until you get some tests back, you do a full investigation. My God.
It's probably ITP.
That's a quick jump. It certainly can be immune thrombocytopenia. I'd like to know what the rest of the blood tests show. Is it just isolated thrombocytopenia?
What the hell is ITP?
Something we can treat.
I mean, below 20, 30, I forgot the exact number, with bruising, the patient should be treated with steroids. Now, ITP usually follows a course of a viral illness, but that still doesn't add up to the fact that she has, the thing is, she doesn't have easy bruisability, which is a hallmark of ITP. She has bruises from a lot of accidents. And I saw the elbow hyper, God, why am I going EDS this whole time? Because when you're thinking easy bruisability, you're thinking connective tissue disorders. Ehlers-Danlos obviously is one that I mentioned, but there's also issues that can happen with platelets themselves or the coagulation factors down the line, like hemophilia, et cetera. So I don't know. I wish I saw all the blood test results.
ITP. So that's
Immune thrombocytopenia.
Used to be called idiopathic thrombocytopenic purpura. Know what idiopathic means?
that we don't know the exact cause.
Yeah, that's true. Usually this shows up not with big, deep bruises. Usually that's more of a coagulation factor diagnosis. ITP usually shows up with these like little bleeding spots, tiny little spots.
Please make him be okay.
I can assure you that we are going to do absolutely
Everything you can, I know. God, this is all my fault.
Mrs. E?
No, he's been so stressed. So I planned this weekend away at Seven Springs, but he didn't want to go because of work. So we fought this whole morning. And then I said awful things. Those can't be the last words we say to each other, doctor, please.
See, this is a very dramatic portion here. As an ER doctor, you can't spend too much time with family members when they're having these kind of emotional outbursts. Not because you don't want to, but you can say a few words of affirmation, allow them to feel seen, explain what you're going to be doing. But then you ultimately can't give them a proper shoulder to cry on, a proper conversation. So that's when you would call in a team member. Remember, the ER, family medicine, inpatient, we're all very team-based. We have social workers, we have counselors. Setting her up early with that is going to be beneficial.
Good news. CT looks normal. No bleeding inside the skull, C-spine, no fracture C.
So if that's happening, why is he having such bad reflexes?
He didn't break his neck?
Then why is he paralyzed?
You can have spinal injuries without radiologic abnormalities.
Sometimes it doesn't show up on CT, only on MRI.
Okay, hold on. We just covered this in one of our videos. When you have, is it a spinal bruise? Yeah, look at that. A spinal cord contusion, like a bruise on the spinal cord caused by trauma, can result in inflammation, swelling, and temporary or sometimes permanent neurologic deficits, and you won't always see a contusion on a CT scan.
Dr. Mohan, are you sure? Okay. Critical potassium level 1.2.
1.2? Sounds sketch. I would obviously repeat, but 1.2 is death. How do you live with a potassium of 1.2?
Wow.
It's got to be a lab error.
Extremely low potassium with generalized weakness and no cervical injury. We may be looking at
Hypokalemic periodic paralysis.
I've worked in a lot of ERs. I worked on different internal medicine floors. When we get a number like that, we would be really concerned for a lab error, but they're going to hypokalemic periodic That's a zebra right there.
It's a rare condition where potassium gets shifted into the cells, causing profound weakness, just like paralysis.
Will he get better?
Yes, back to normal in a few hours.
How do they know? I mean, is this a diagnosis of exclusion? All they know is that a person was involved in a major trauma and has a critically low potassium that they don't know if it's a lab error or not, and they don't really know the cause, and they're jumping, I don't know. I feel like this is a really rare diagnosis, outside of my scope to even speak on, but very, very shocking. Like, if I was going down an algorithmic pathway in an ER setting and I see a potassium of that low, that number that low, I don't know if I jump to that as the first diagnosis. I think you have to rule out other conditions. And you have to make sure that the heart is stable, getting an EKG.
Bag him.
Yo, that was crazy. That was legit crazy because that was the perfect pause.
Starting compressions, charge at 200. What is happening?
Is he going into VFib?
Low potassium can harm electrical activity in the heart.
Charge.
Clear.
That was probably the coolest call we've had on the channel so far. That's why they were so calm. I'm like, how are they so calm about a potassium 1.2?
Thumb and forefinger make a C, bottom three fingers make an E for jaw lift. One breath every 5 seconds. Good. All right.
You know, I was taught every 6 seconds, but it's the same difference. And I would like to see the balloon fully get compressed and then fully open.
Holding compressions. Normal sinus.
Carotid, strong carotid. Okay, let's try for BP.
He said strong carotid. I didn't see anyone check it, but I'm glad that they did. Bagging is important.
Why don't we check after the shock?
2024 ACLS guidelines. Patients can remain pulseless for a little bit even after successful defib.
He came back with one shock. That's as good as it gets.
So in a patient like this, even though his heart stopped, the outcomes are not as bad as it would be in another patient who is much more ill. Reason being, the thing that caused his heart to stop is very reversible, which they're doing by giving him potassium, as well as having the defibrillator put the heart into the correct rhythm.
He's breathing on his own. Excellent sign.
So here, at this point, you would have to decide if you're gonna fully sedate the patient and intubate them.
Oh, shit.
Oh.
Gurney! Nancy. Mrs. Yi?
Okay. I know I'm not an ER doctor, but when someone collapses and the first thing you do is not check their pulse, I'm gonna lose my mind. Why we went to the eyes first is very, very surprising to me. I mean, granted, she had a trauma at this car accident, but clearly it wasn't a significant trauma.
Weak carotid, shallow breaths.
So she's saying she has a weak pulse and she's not breathing deeply?
Positive seatbelts. Oh, shit.
Oh, she's bleeding internally. They didn't do a full exam on her because she denied it. She could be losing a lot of blood. She looks pretty pale, bruising internally. They need to get that ultrasound out quick.
Hang 2 units of O-negative, the rapid diffuser. Somebody call Garcia.
They're using O-negative blood because they don't know her blood type. They're gonna need to type and cross. Once they do get her blood type, they can then switch off of the O-negative.
We really should have insisted on examining her.
You did, and she said no, which people are allowed to say no.
Platelets are these tiny things in the blood that help it clot, and thrombocytopenia is fancy for low platelets, which explains why your skin bruises so easily.
Also, when you see a platelet number that low, you also have to do a smear and check for platelet clumping to rule out pseudo thrombocytopenia. I'm hoping they did, but who knows?
And what causes it?
It's actually her immune system that's causing the destruction of the platelets. Sometimes it's a triggered response to an environmental factor or a virus.
And what's the treatment? What are you giving her?
Prednisone?
We'll be treating her with high-dose steroids to suppress the immune system and IV immunoglobulin, which reduces the destruction of the platelets in the spleen.
Also, with a platelet count of 8, the fact that she's not bleeding a lot from that cut is kind of surprising.
This is Gretchen Williams.
Actually, it's Lambden. You called about my ex-husband, Michael.
Yes. Thank you for coming in. You were listed as his emergency contact.
Oh, she did do the thing that we asked. This is great.
I don't know why. We have been divorced for years. Is he all right?
He's going through a lot right now. Would you like to see him? Okay, Leo, can you zoom in and please hold it a little steadier?
This is like the more ethical version of what would happen versus what would happen on House. On House, they would break into the person's home, rummage through all their stuff, and then find some miraculous poison that's causing the hypotension. God, there's way too many meds there to know what's what.
Okay, atorvastatin.
Not it.
Simvastatin.
Not it.
Ezetimibe.
Nope. People are storing cholesterol meds.
Those are all high cholesterol medications. Can you go to the right? Lisinopril.
Okay, that's that ACE inhibitor that I was mentioning could be the culprit.
Losartan.
That's an ARB, angiotensin receptor blocker.
Propranolol.
Propranolol is a beta blocker.
Wait. That's it. Wendy's pile. Yellowish bottle, little round blue pills, just like I said.
Propranolol?
Bingo, little lady.
Propranolol is a high blood pressure medication. Those are 20 milligrams each, and the starting dose is 40 mg. How many pills did you take?
Oh, I think 4, maybe 5.
That is a lot. Okay.
Propranolol is also the medication that some people take before doing a public speaking appearance, a big musical performance, as a way to decrease some of those symptoms that people get when they get nervous. Sweaty palms, racing heart rate, etc.
Unit 3 and 4 running in. BP 84/56, heart rate 112.
Free fluid's much bigger than before.
She's not turning the corner. OR's holding a room.
I'll let the husband know.
Why'd you guys wait so long to check her?
Good vitals in the field, no distress. She refused to sign in.
You should have convinced her.
20/20 hindsight, she was stable.
Until she wasn't.
Next time I'll use my X-ray vision goggles.
X-ray vision goggles and ignore patient autonomy. Come on.
Is this how it works?
How what works?
You think things are important? That everything's so important? And then you end up here in C.
Yeah, that is how it works.
A lot of the biggest changes that patients have made in their healthcare under my care have come as a result of a wake-up call like that. I wish it didn't have to come to that. In fact, when I rewatch some of my Jubilee debates and I see some of the people who say, why don't patients take into consideration lifestyle changes? It's because you doctors aren't telling them. A lot of times we are. Patients don't want to, can't, whatever the reasons are. And I would love to hear unique ideas of how to get more people to make lifestyle changes happen. Because it seems like every person who I debate makes this false comparison of like either do lifestyle changes or pharma, where I would love for lifestyle changes to be made, but it's not always feasible to get a patient to make that change.
I'm sorry that they called you. I never updated the form, I guess.
No, it's okay. They called and I was just kind of surprised.
Well, you didn't have to come.
But I did.
Rekindling a little romance.
Why don't I leave you guys to talk for a few minutes?
Fair play.
I have a patient to check on.
You should also probably warn her that he exhibited some confusion and might say some stuff that he doesn't mean or remember.
Jackson Davis, tox screen negative for cocaine, amphetamines, marijuana, PCP, benzos, and opioids.
So no drugs in his system?
Nope.
But what is in his system, or what is flagging on the blood tests?
Changes things, Tony.
Hey, how you doing?
I haven't seen him in like 4 years.
I can't imagine. That must have been
So crazy. Things were not good at the end.
It could be because of that tumor.
Could that mass have been there for a while?
Yep, especially in the area in which they found it.
Yes.
Could it be responsible for how much he changed? His moods and tempers. He was getting into fights with strangers.
People who have damage to that part of the brain will frequently use vulgar language when they used to not, get fights with strangers. So all of that really does vibe with that diagnosis.
PTMC charge nurse, go ahead, medic ma'am. Is this a drill?
Uh-oh.
Is this a joke? It's the 4th of July.
What? Uh-oh.
Got it. Thanks.
What's up?
Westbridge has a code black and is closing to internal disaster. Central's diverting all their ambulance traffic to us.
What's the issue?
Comspec didn't say.
Shit, it could be anything from a flooding toilet to a power outage. How long?
Didn't know.
A couple of doctors probably got the holiday flu and they're understaffed.
Oh, I should have left last night.
There's always a story. The first doctor that recommended we wash our hands was murdered. Click here to check that out, and as always, stay happy and healthy.